I'm Jeff Ginsburg. I'm going to be giving the last talk in this opening session. Thank you, President Johannesson, for staying here through the coffee break and giving us your valuable time and remarks. I'm going to really tell us how we got here and maybe where we're going or where we aspire to go as a consortium. And it is preaching to the converted. That is the expression that we use in this country. We're here to bring cohorts together because there are, as represented in this room, many large-scale efforts already underway across the globe, but yet they are somewhat constrained, even though some of them are quite large. Size is always an issue, as well as geography and also the sort of ethnic origins of many of the cohorts around the globe. This obviously limits the abilities of any one cohort to do extensive analysis, so there's an obvious opportunity for bringing these efforts together to enhance the value of the cohorts, and importantly for the funders, the ministries of health, the national research organizations that are supporting them to actually extend and leverage that important investment that's been made. So in terms of how we got here, the literature, yourselves, many of you in the room have established the value proposition for cohorts in determining the etiology of disease, predicting future health risks, as well as the ability to even launch novel therapeutic strategies. In 2005, the National Institutes of Health began compiling a list of cohorts over 100,000 individuals, either existing or that aspire to enroll that number in the future. In 2017, HEROES, the heads of international research organizations, then led by Francis Collins and Jeremy Farrar, who I think is the current chair of that organization, got together and said, we really would like to see us, create a collective of cohorts that would really establish a platform for sharing data and improving the overall effectiveness and efficiencies of the large-scale efforts that had already been underway. So with both the HEROES direction as well as the support from outside funders, we had the first summit that many of you attended in the United States a year ago. At that time, we launched a series of teams and work streams I'll tell you a little bit about, and that represents the agenda for this afternoon, that would be developing a series of plans for this consortium going forward. And earlier this year, you all received a request for ideas. We wanted to see this be a ground-up opportunity to get your ideas of how, from your vantage point, your cohort, the populations that you're studying, combining with other cohorts around the globe, would actually create a significant scientific opportunity for not only for your efforts, but also for the efforts of the consortium. And today we're here for the second International Cohort Summit to really set the scientific agenda of the IHCC, this International 100K Cohorts Consortium, supported by the Global Genomic Medicine Collaborative and the Global Alliance for Genomics and Health. So in March of 2018, as I mentioned, we had our first summit sponsored by the Wellcome Trust, the Medical Research Council of the UK, and the All of Us Research Program at the NIH. The four main criteria for being part of this effort were having, as I said, 100,000 existing or anticipated enrollees, unselected for disease, so we really were, while it's extremely important, we were not interested in cohorts that were laser focused in cancer or cardiovascular disease or diabetes, but really were looking at all possible disease manifestations, that biospecimens would be available either now or certainly in the future for molecular analysis, particularly genome sequencing, and that the opportunity was there for longitudinal follow-up. So with that, we had our summit. For those of you that were or were not there, I encourage you to go to the website, whose URL is listed here, both for this incredibly extensive meeting summary that's maybe a couple hundred pages, or the executive summary, which is a lot easier to digest, for understanding what transpired during that, I think, landmark meeting about a year ago. This is a snapshot of what was in the room in March of 2018. I think we're actually quite similar today, with then 100 attendees from 24 countries, 60 cohorts were in the room, representing at least 30 million participants. Now, I urge you to really think about the profound opportunity that having data from 30 million individuals around the globe, multiple ethnic groups, multiple geographies, multiple socio-demographic groups would advantage our field, as well as the advancement of science, and to the point that many speakers this morning made to the impact on healthcare. These slides will be available. I saw many people taking pictures of this, but these slides will all be available to you. So at that time, our objectives were to really explore the feasibility of a global registry of cohorts to assess the compatibility of various cohort elements, including consents. We also did not use the word harmonize as well. Also to think about the policies that would be required for data sharing and possibly specimen sharing, and the opportunity for us as a collective to engage sequencing platforms and really drive down the costs of sequencing and achieve sequencing at scales never before able to be reached by any one cohort alone. We left that meeting with a vision that was to create a global network for translational research that would utilize large cohorts to enhance our understanding of the biological and genetic basis of disease. Probably we should also include the social and cultural aspects, as Mary Da Silva indicated we should, to improve clinical care and population health. These themes were echoed by many of the speakers this morning. Our priorities have been to create an atlas of cohorts and deposit data. We haven't deposited any data except for survey data, but you'll hear about the atlas a little bit later. To review and reconcile country-specific data access policies and to assess consents, and here we did use the word harmonize. Assess the opportunity for interoperability of phenotypic information, particularly algorithms that would be deployed across electronic healthcare records, and to think about pilot studies that would be used to actually put cohorts together, both to compare results as well as to jointly conduct analyses, and to importantly support the development of genome-derived data, particularly in cohorts with limited resources. And finally, to establish platforms that would allow for analysis of and create environments for collective analytical work. So we also left that meeting with a strong feeling that we needed to have the engagement of this community. We needed to develop an infrastructure that would allow for sharing of data and standardization. We thought about the concept of a federated platform that would respect country-specific regulations around both data transgression across national borders and particularly sample movement. And we also were quite excited about the opportunity to bring new samples, new types of analyses, new enhancements to cohorts, and as well as in terms of molecular data, as well as to improve our understanding of environmental exposures. And finally, to develop systems that will allow us to capture the long-term outcomes in these, particularly in resource-limited settings. So over the last year, first of all, we've made all of the materials from this consortium available at the g2mc.org website. There's been a paper drafted, ready for submission, that will probably go to a journal after the input from this meeting. We established 3 work streams and work teams, one on data standards and interoperability, led by Philip Awadallah and Thomas Keene. The second is on the scientific strategy and opportunity for cohort enhancements, led by Adam Butterworth, Hakan Hakanaraisen, and Gadi Rennert. And the third is on policy issues and biodata sharing, led by Peggy Knudsen and Laura Rodriguez. And of course, the request for ideas and the discussion that will take place this afternoon was a major deliverable since March of 2019. So many of the topics that you will hear this afternoon have to do with research involving rare conditions and exposures, the opportunity to take advantage of exceedingly rare genotypes, particularly will be discussed will be the opportunity for human knockout project, as well as extremes of risk and resilience. The notion that we have through some of these cohorts, important founder populations and areas where there's consanguinity, giving an opportunity to conduct scientific investigations that are not possible in other regions of the world. And it should be, I think, acknowledged that once we get this underway, the cohort, it's the consortium itself and the cohorts therein will provide incredibly unique training opportunities for the next generation of scientists that have to actually carry the torch forward over the next 10 or 20 years from where we are today. So what we hope to do in the next 28 hours is, first of all, in the next session, we're going to learn about other opportunities for partnership. We, as a consortium, do not want to be a silo. As you'll hear, and as we've already mentioned, there's going to be a discussion about a queryable atlas around, that will enable for research around the globe, as well as the data architecture that will support cross-cohort collaborative opportunities and analytics. We're going to spend a lot of time on the scientific agenda for this consortium and selective cohort enhancements that could actually improve what all of you have already done. Needless to say that not only will the scientific agenda require the data piece to be functional, but also a robust policy agenda is quite necessary to support many of the things we're talking about over the next day or so. And we want to channel this into an opportunity for sponsors, both our current sponsors, the Wellcome Trust, the National Institutes of Health, but as has already been mentioned, the opportunity to bring industry partnerships into this consortium, and we will develop the rules for engagement of industry for sure. So I just want to welcome all of you to Iceland again. We have 115 attendees at this meeting. We have 25 countries represented. There are several new cohorts that are in the room that are listed here and that are also in your booklet. I also want to hope that you will all enjoy your time in Reykjavik. And Hakan had reminded me, but I forgot to mention that I think it's important that you visit the concierge and think about the tours that are going to take you to many wonderful sites and places while you're here over the next couple of days, I hope. I'm looking forward to a highly productive and interactive meeting. We've had some great questions already, but this afternoon is going to be incredibly rich. Again, I thank you for making the journey here and for being part of the IHCC.